Cookeville Regional Medical Center, the Upper Cumberland's proven choice for healthcare. Here's Jill Bowman.
By this time in our life, many people thought we would be seeing flying cars and living in a much more futuristic world. Well, some things have changed. How about surgery with robots? Come take a closer look with us as we explore the robotic surgery program at Cookeville Regional.
Many physicians have been instrumental in the success of the robotics program at Cookeville Regional. Dr. Quentin Cancel tells us how his interest in robotic surgery began.
I was actually an intern when robotic surgery started to become more prevalent in urology. And as an intern, you don't really get hands-on, so I was sort of looking around and trying to just glean all the information I could. And as I progressed in the program, I was able to be a second assist and first assist, and then eventually get some consult time my chief year.
Dr. Berkier has seen tremendous advantages for his patients in utilizing the Davinci robot.
There's typically less blood loss associated with Davinci robot surgeries. There is less recovery time, shorter stay in the hospital, and there's just less pain associated with it compared to the old traditional laparotomy surgeries.
Cardiothoracic surgery, I believe, was the first service to provide robotic surgery here. Since that time, it's expanded to urologic surgery and GYN surgery.
One of the things that has impressed me about the Davinci robot is it allows you to do very intricate, detailed surgery. With the robot hands, you can move them in greater detail and in full 3D magnified vision compared to open procedures.
You have the console where the surgeon operates from, and then you have the actual robot that's docked at the patient's bedside. Once the robot is docked and I'm at the bedside to perform the docking of the robot, the surgeon then goes over to the console, which can be across the room from the patient, and begins to operate. We operate through a viewfinder that's linked to the robot, and we look at a 3D picture of inside of the patient that's magnified 10 times what we normally would see.
For Hilton Conger, a Smithville attorney who was faced with prostate cancer, having surgery at the Robotics Center of Cookeville Regional was the perfect choice.
I was being seen at Vanderbilt, and was actually scheduled for surgery. And, you know, at a teaching hospital where you've got residents, I mean, they have to learn somehow, and I'm sure they get hands-on experience, so I just didn't want it on me. I had a doctor friend here in Smithville that had seen Dr. Cancel a couple of years ago, I guess, and had the robotic surgery. And I thought, well, if it's good enough for another doctor, it ought to be good enough for me. I had a question as to whether he was actually physically in the room or was he operating a robot remotely somewhere, and he assured me that he would actually be in the room. I just wanted a little confidence that if something went wrong, he was going to be there. Dr. Cancel assured me that he would be the man doing the surgery, and he would be in the room operating the robot. So made the choice right then. We scheduled the surgery the day I was in his office the first time.
You know, I've had that question before in my office when I've said I'm going to utilize the Davinci robot. They're like, oh no, I don't want the robot to do my surgery. I want you to. And so what I tell them is that the robot can't do anything that I don't tell it to. It's interpreting my move or my movement of my hands and translating it to the arms of the robot. And there's several safety devices that's built in to prevent that robot from doing anything unless I tell it to.
Very scary, but I mean, I had true faith, and you know, he was able to do it, and he had told me he'd done plenty of them and been doing it for a while.
The next morning, I got up and walked out before lunch, and it was amazing.
I can't believe just even what I could do. Like, I went to Florida 2 weeks, not even 2 weeks after. I went to a wedding on the beach, and so it really has been pretty amazing to me.
Most of them go back in 2 weeks. I have had a couple go back in a week, and I had one leave the hospital and go by her work to pick up paperwork and do a few things on her way home.
Dr. Cancel had discouraged me from being so active. He just said, I know you feel good, but you're still healing. Don't be swinging a golf club. I had a 3-week follow-up, and I'd already played golf before I went back, much to his dismay, I think. But and when I say I'd played, I hadn't played 18 holes of competitive golf, but I'd gone out and hit golf balls and played some.
Most of the patients that have the robotic surgery now, they are, of course, going home the next day, but they're often only getting one dose of pain medicine.
Some even say they never had pain, which I find hard to believe, but that's what they tell me.
I believe I had some pain medicine while I was in the hospital, but other than a couple Tylenol, once I got home, I didn't want any kind of pain medicine.
It really is phenomenal that you can have a major surgery like this and really have no pain associated with it.
Not only do the doctors use the Davinci robot, they also are sought after for teaching purposes.
I know Dr. Cancel's traveled all over the country proctoring. I've been several places now and have been requested to go as far away as Chicago and New Jersey to teach physicians how to do robotic hysterectomies and robotic pelvic support surgery. And then, of course, we're involved with teaching or training our own physicians here on staff. And we've developed a team approach here now to where we have the same OR teams with us with almost every surgery. And by doing so, it improves the quality of care for those patients. I'm not having to think about what everyone in the room has to do. I worry about what I'm doing, and then this staff we have now, they anticipate what I need before I even ask for it. And it makes for very efficient surgery, and it makes a lot of fun, actually.
I grew up in the age of video games, and we're sort of used to controlling things remotely. And so it's just technology that's very comfortable for me. I think that it offers several advantages to me as a surgeon. It offers me to get in small places that my hand couldn't reach because of the small instrument sizes. And I think it's just better off for the patients in general.
They go home so much faster, they recover faster. My patients are incredibly happy with it.
If you went to a doctor that didn't offer it, to certainly search out somebody who did, because it's so much better for the patient.
Well, I have already referred people to Cookeville, not only to Dr. Cancel, but to the hospital. This was very positive, very positive.
I would say I'm just really excited about the opportunity here to develop a robotic center of excellence in Cookeville. I think this will distinguish us from the other programs in our area and in the state to be able to offer the full complement of 5 robotic surgical specialties in this area. I think is an advantage to our community and all of our patients that we're offering this high level of medical care here.